So this is lab week 2 for PT, and I'm going to be doing some examples of massage techniques. So first of all, the indications for massage would be to increase blood flow and venous return, to provide pain relief, to decrease muscle spasms and remodel collagen, and then of course relaxation. Some contraindications or precautions would be people with bleeding disorders. We would want to avoid massage over areas where there's an open wound or an infection, where there's a fracture, blood clots, or any weak bones or post-surgery. And then we'd also want to make sure that anyone who's pregnant or a cancer patient gets permission from their healthcare provider or oncologist before they seek a massage. So to prepare the patient before any of these massages, you want to warn them that it may hurt them, and that to ask them to please let you know if their pain gets to an 8 out of 10 or beyond 8 out of 10, and so then you can back off. You want to perform it for about 5 to 30 seconds, per point or area you're working on, depending on the tissue tightness. And then you want to warn them after they're done. Actually, you want to tell them that they might be sore, they might have bruising, and they need to drink a lot of water, and followed up with mobilization and exercise as well. So the first technique that I'm going to demonstrate is effleurage. So we would use our palms, and we can do it light or deep, and we want to go towards the heart. So if this is my patient's or person's back, then we would want to just do strokes for 5 to 30 seconds towards the heart. If we're going to do it light, it would be for relaxation and sensory reflexes. And then for deep, we would do it to provide lymphatic and blood circulation. So I would use both hands if I wasn't videoing, but that's effleurage. For petrissage, this one, I'm just going to do it on my leg for right now. So at first, you would just be like this with your thumb and your fingers, and you would lift and knead. So you would just be here lifting and kneading, and then you can roll and knead as you work your way through the tissue. This is going to help stretch, separate muscle fibers and fascia, and then also as well as scar tissue. So that's petrissage. And then I would also perform it for 5 to 30 seconds, and I would roll it out. So I can't really show you like that. For friction, this one is, you're going to you can use your fingertips or your knuckles, and you're really gonna go, either cross or down with the fibers, to increase circulation, tissue, and temp. So you're really going deep and pressing in, and then you would want to do that through the area. So that's friction. This is going to break adhesions and realign. For myofascial release, you really want to pull the tissue in the opposite direction. You can use their body weight gravity, or you can use both hands. But for my sake, I would be holding down at the bottom there, and I would just be really just trying to lengthen out. It works really good when you're using it like with the neck. This is going to lengthen the fascia and restore range of motion to decrease adhesions. To perform tapotement, you can do it in 3 different ways. You can do the karate chop or the hacking, where you're using your hypothenar. And you're going to do that in repeated rhythmic strikes. You would do it with 2 hands, most likely. You can do the cupping, where you're just, your hand is like this, and the sides of your hand are just touching. And then, or you could do the typing. And this is going to help with respiratory issues, moving that phlegm, and or also stimulation for pre-comp preparations. Vibration, you can use a gun, or you can actually use your hands to shake the tissue back and forth. So just as if a gun would be, you know, you're gonna just relax the muscles, and you can also use it for stimulation for pre-competition as well. And then for cross friction, this, you want to kind of do a shearing motion. So you can either do it in circles, or you can do it transverse. But this is going to increase tissue extensibility. So you can go here. This also is going to promote collagen alignment and prevent and treat adhesions. You want to follow this up with stretching and therapeutic exercises for increased ranges of motion.